Hello, ladies and gentlemen. This is Dr. Phil Hong Nguyen with Happy Clinic. There's been 3 medications that have been on the top of everyone's tongue when they were released. First was Botox for wrinkles. Second, Viagra for erectile dysfunction. And now it's Ozempic Mounjaro for weight loss. Today, I've got a before and after for my very first patient. She's on Mounjaro 2.5 milligrams for 1 month. We'll call her Rose. Rose is 31 years old, 4'11", and weighs 150.6 pounds, which gives her a BMI of 30.4. To get to a BMI of 24.9, the high end of normal, her weight should be less than 123 pounds. So she's about 27.5 pounds overweight. We started her on Mounjaro 2.5 milligrams, and within 1 month, she was down to 137.6 pounds. Amazing progress, but still about another 15 pounds away from a normal BMI of less than 25. She reported similar reactions to me on the first day of the first shot, feeling a little nauseous and not wanting to eat. She did note that she threw up a few times after consuming alcohol with her meal and also after eating sushi. So she stayed away from alcohol and raw fish. She was a chef and a restaurateur and loves to cook and eat. But after getting on Mounjaro 2.5 milligrams, she felt her appetite lessened dramatically, where she would only eat a third to a half of what she would normally eat. Her clothes began to become loose, and in this after picture, she had to buy new underwear because her old underwear was just too loose. Right, let's look at this before and after picture. It's exactly 1 month from the time she started taking Mounjaro. The first thing I want you to notice is her submentum right here, the area underneath her chin. Look how much weight she's lost in there. This is about 14 pounds that she's lost. She's lost a little pocket of fat underneath her chin, her gobble neck, and much better profile. Secondly, the most obvious is her belly. Look how much she's lost there in her belly. Now, obviously, this doesn't take care of any loose skin. She's had 3 kids already, but she's ecstatic about how much she's lost as well. And then thirdly, you can see it in her arms as well. She's lost a significant amount of weight in her arms. Again, she's still about 15 pounds from her ideal weight of about 123 pounds for her height of 4 feet 11 inches. Alright, so now let's look at her front view. Let's look at her face again. Do you see that? Do you see her jawline, how blended that is? Whereas here, it's sharp again. Amazing. She loves that in her face. Her face is slimming up. She's got more definition for sure. She's got a different bra and different underwear here, as you can see. And see how much difference there is in the abdominal fat area. She's got some loose skin here, obviously, again, because she's got 3 kids. And also notice the difference in her arms as well. Much thinner too. Again, she's about 15 pounds from her weight goal. I'm happy to put her on and keep her on Mounjaro 2.5 milligrams for another month and see how much further she loses. She loves it, and I hope you do too. I think this is a miracle medication for patients struggling with their weight and unable to control their appetite. You feel full and satisfied on Mounjaro, and eating just a few bites is enough for you to feel satisfied. Your thoughts are not on food all the time, so you have time to enjoy the rest of your life. I have clinics in Orange County, California, and Denver, Colorado area. Make an appointment today, and I can help you get back to a healthier lifestyle. Please like, subscribe. This is Dr. Phil Hong Nguyen with Happy Clinic. Take care. Bye-bye.